I'm going to go ahead and get started in the interest of everybody's time. Before we move forward, Tyler, can we just do an audio check? Can you hear me okay? Is my volume okay?
Yep, I can hear it great.
Okay, good. And just want to make sure that everybody on the webinar is able to see me. I know there are different views on computers, and there have been times when folks haven't let us know at the end that they weren't able to see me. So if you're having trouble viewing me, in addition to the PowerPoint, please put that in the chat so that Tyler can guide you through that process. It usually is just a matter of changing your view. Tyler, do you have any thoughts about that? Any recommendations for folks if they're having trouble seeing me?
I would just recommend just playing around with the control panel that they have. There should be an icon somewhere that allows you to change your viewing options. It could be above the presentation that you're seeing on the screen now, or in the control panel on the right-hand side that you may have. So I just play around with it, and if you can't figure it out, just reach out.
Okay. Thank you so much, Tyler. And of course, this is being recorded, so it will be available in the future. We'll most likely post this on our website. Just to quickly introduce myself, I'm Carolyn Lamparella. I am the Program Director for Preferred EAP. We are a local Lehigh Valley Employee Assistance Program. We serve Lehigh Valley Health Network, as well as companies all across the Lehigh Valley and greater Lehigh Valley region. So today we are going to be talking about breathing new life into 2021. And I just want to give you a little bit of a summary as to how this came about. You know, this time of year, January, February, is a time of transition, right? I'm thinking back to New Year's Eve, going into New Year's Day, watching, you know, the news and TV. Everyone was sort of saying, you know, adios 2020, you know, welcome 2021. You know, it was a hopeful time. We were really feeling like, okay, we got through 2020 and now 2021 is going to be so much better. Well, you know, obviously that's not 100% true. 2021 has been tumultuous, just like 2020. And so, you know, when we think about, you know, January and setting New Year's resolutions and, you know, that optimism we feel at the beginning of the year, you know, so much of our focus is on the stressors. You know, we think back to 2020 and all the stressors that we were facing, you know, COVID-19, the social injustices, the social unrest, the protests, the political environment. And now we're going into 2021, and it's clear that those stressors have not gone away. So at EAP, one of the things that we're constantly reflecting on is what is the best way to support employees? How can we help you contend with these stressors more effectively so that you have a balanced, fulfilling life? And so, you know, a lot of our efforts have been designed around activities that occur outside of work, right? The Employee Assistance Program, we provide counseling, coaching, consultation for folks who can reach out to us and get support outside of work, right? We have a lot of wellness programs in companies that offer activities that you could take advantage of outside of work. Well, it's clear that just looking back over 2020, that one of the greatest challenges we're all facing is we're in an energy crisis, right? We are struggling to conserve enough energy throughout the day to have something left for the rest of our lives, to have a fulfilling, balanced life. So this webinar is an attempt to get us to refocus our attention on our day-to-day activities, and find strategies that work immediately. You know, many of the things that, you know, we probably have developed New Year's resolutions, and most of those tend to be around diet and exercise, really important things for us to be focused on. But those tend to be long-term. You know, we have to commit to those long term in order to really experience that immediate feeling of relief. You know, unfortunately, one of the things that we're seeing through COVID-19, through 2020, is there's been an increased dependence on substances, food, alcohol, you know, drugs, things that create an immediate effect within our body, right? And why is that? It's because, you know, we're not able to commit to some of those activities that provide us with that long-term assistance, that long-term support, you know, where our socialization has changed. You know, the activities that we're able to engage in outside of work have changed. So for many people, they've turned their attention to things that give them an immediate feeling of relief. Well, that's what we are going to be focused on, is how can we give ourselves that immediate feeling of relief without depending on substances that have long-term negative consequences. So I like to begin. Tyler, you can move to the next slide. I always like to begin this conversation just by reminding us, and those of you who have been on some of my webinars, this will be a repeat for you, but I think it's important for us to always remember how our stress response system is designed to work. As you can see from this diagram, we have two parts. The sympathetic nervous system, which is what we traditionally associate with stress, right? That feeling of our heart rate increasing, difficulty concentrating. This is the part of our nervous system that revs us up, right? It increases our energy so that we're able to contend with whatever stressor we are facing. And I refer to it as the on switch. The parasympathetic is the rest and relaxation part of our stress response system, right? This is the part that engages to help us restore, recover our energy. And this is, you know, the part that's very active during sleep, during activities that just relax us. This is when our parasympathetic nervous system is engaged. And ultimately, what we want to see is balance between these two systems. You can move to the next slide. And I like to, you know, think about or talk about stress in terms of the way animals experience this. When I started teaching about stress, I read a book called Why Zebras Don't Get Ulcers, written by Robert Sapolsky, who studies the stress response in animals, and in order to better understand how we humans experience stress. You can see from this image, you know, the zebras are locked in, their gaze is locked in on this lion, this predator, this stressor, right? They're priming. You can imagine what those zebras are feeling within their body in this moment. Their sympathetic nervous system is active. Their energy is getting primed in order to respond to this stressor. One of the things that's really important to notice is their eyes. Our eyes are part of our nervous system, and they are designed to help us scan our environment constantly and send messages to our body so that we are reading the environment correctly and our stress response responds accordingly. And as you can see, these zebras are locked in, hyper-focused, right, on this lion. Well, what happens as a result of this hyper-focus? What is our stress response system preparing these zebras to do? You can move to the next slide, Tyler. Well, as you can imagine, the response is to run, right? We would all have that response, I hope. Those who don't have that response are likely to not survive. So this response is really important. It is part of our survival. Our sympathetic nervous system is designed to create that feeling or that desire to move, right? It predisposes us to that action. And sometimes it's physical action, physical movement, and sometimes it's other type of action. But our stress response system is really designed to help us get going, get moving, so that we're able to respond to that stressor. After we respond effectively and we resolve that stressor, what happens next? You can move to the next slide, Tyler. This happens for zebras, right? Their parasympathetic nervous system engages. They're able to go into rest and relaxation. Their gaze shifts from hyper-focus to panoramic vision, right? So that they're still aware of their environment, but not necessarily locked in on anything. And this helps to facilitate the action of the parasympathetic nervous system. One primary difference, and why zebras don't get ulcers and humans do, as you can imagine, is when the zebras are hanging out by the stream, they're not thinking about the lion, right? They don't care where the lion is. They just know they got away from the lion, and now they're just relaxing and restoring their energy so that they are prepared to deal with the next stressor, the next predator. Well, we as humans, unfortunately, we have the ability to continue to keep that stress alive in our mind just by thinking about the stressful event. That's all it takes for us to bring on a stress response, is for us to have a thought about, oh my gosh, I can't believe that just happened. Replay the event over and over again. Tell the story again. And every time we do that, we're keeping that stress alive and active in our body and preventing our parasympathetic nervous system from doing its job, to restore our energy. You can move to the next slide, Tyler. And so let's think for a moment about COVID-19 and what it has done to our stress response. When we're in that state, that activated state, the goal is for us to figure out, what is the duration of the stressor? How long is it going to last? What path do I need to be on in order to resolve it, right? We're constantly looking for feedback to help us understand that we're on the right path. And then what is the potential outcome? If I stay on this path, is it going to get better, right? And so think about COVID-19 and what it has done to us. We have been hyper vigilant since March of 2020, and maybe even a little bit before then, because when it really became clear that this COVID-19 was going to affect us, right? So it has kept us in this state of hypervigilance without the ability to answer these questions. How long is this going to last, right? Am I on the right path? If I do these things, if I wear a mask, if I socially distance, if I minimize my activity, if I get vaccinated, if I do all these things, is it going to protect me? Does that put me on the right path? And what is the outcome? That's part of what we're all sort of wondering about 2021 and what we're looking for. We're always looking for reassurance that what we're doing is going to result in a different 2021. Well, unfortunately, you can move to the next slide. Because we have not been able to answer those questions, we have remained in a state of chronic stress, whether we are consciously aware of it or not. And the end result, as you can see from this diagram, in the beginning, in phase one, you think back to March of 2020, phase one, we mobilized, we figured it out. For many of us, we went from working in the office to working at home. If you're a teacher, you went from teaching in the classroom to teaching from home. We got it done, right? March, April, May, we figured it out, where our stress response system prepared us, and we were able to get into a new way of operating, new habits, new routines. And so for a while, we were performing pretty well, right? But over time, as things don't improve, as we continue to face the same stressor over and over again, the end result is phase three, which is exhaustion. And this is my concern for all of us right now. What I'm hearing from so many people is that you're just exhausted. At the end of the day, you're exhausted because it takes all your energy just to figure out how you're going to get through your workday, right? Because your workday has changed so much. Whether you're working from home or working in the office or in your previous setting, it's different. And so we have new routines, new habits, new behaviors, and all of that requires energy. And over time, that results in that feeling of exhaustion. So what do we do about that, right? Knowing that we don't have direct control over so many of these stressors that exist in the world right now, right? We can't say with certainty that if I do the X, Y, and Z, it's going to end COVID-19, or it's going to, you know, change our political dialogue or the social unrest, right? We're having a hard time with that. So what is the goal? You can move to the next slide, Tyler. The goal here is to practice letting go of the stressor and turning our attention to the stress. Because stress, our experience of stress, has nothing to do with what's outside of us. It has everything to do with how we are perceiving that stress. And the stress exists within our body. It is a physiological response to what is happening outside of us, right? The good news is, in comparison to the stressors, we have the ability to mediate, to impact our internal stress. We have the ability to improve our energy, to increase our energy, just by focusing on our attention on the stress that we are experiencing within our body. So what does this mean? You can move to the next slide. It's sort of like, you know, moving from portrait view to panoramic view. If you can think about portrait view, you know, on your phone, when you are staring at your phone, you're sort of narrowing your gaze, right? You're putting your focus, your eyes, into this little box, right? It's portrait view. It keeps us in that state of hyperfocus. And that's one of the challenges. We had this challenge pre-COVID, right? The amount of time we spend staring at our phone, that is putting us in hyperfocus for most of the day. And without, you know, it doesn't feel necessarily stressful when we're looking at our phone. We're not aware necessarily of having, you know, that strong response that we would have like a zebra facing a lion. But what happens is, over time, when we stay in that portrait view, our stress hormones are sort of gradually creeping up, okay? They're building up within our body beyond our awareness. And by the end of the day, they sort of reach a peak level if we've been in hyperfocus all day. This is, you know, now we're talking about, you know, before we used to talk about our cell phones, now we're talking about Zoom fatigue, right? And we're wondering, like, what is Zoom fatigue? Well, Zoom fatigue is a real thing, right? It's actually occurring as a result of us staring at our computers, narrowing our gaze all day long and staying in portrait view, right? So one of the most important things we can do to help ourselves is to practice going in and out of these states. Portrait view, where we are hyper-focused, attentive, engaged, contending with the stressor, to panoramic view, which is sort of like sitting on the beach where you're staring off in the distance and relaxing your gaze, not focused on anything in particular, and just allowing your energy to restore. In that moment, when we're shifting, what's happening within our body is there's a neuromodulator. It's like a neurotransmitter, but it's actually referred to as a neuromodulator, dopamine, which gets released when we are in this panoramic view. And dopamine is really, really important, because dopamine is known as sort of like the reward neurotransmitter. It's what gets released when we accomplish a goal. But it's more than that. Dopamine actually helps maintain our energy level throughout the day. There's research that was done on professions, you know, really hard professions like healthcare workers and folks who are in the armed services who are doing a really hard job throughout a long period of time. Surgeons, right, who have to be really on alert all day long. Well, they're finding that they're actually not hyper-focused all day long. What they're doing is they're going in and out of these states. This portrait view where they're hyper-focused to panoramic view where they're allowing that moment of pause, that moment of relaxation, just to restore themselves a little bit and then go back to the activity. So the way I think about this is like a micro recovery. You know, most of us think about when we think about restoring ourselves, we think about vacation, taking time off from work, getting away, disengaging. And that is important. Those macro recoveries are important. But I'm finding that, especially if you're in a profession where there's staffing shortages, or if you're a teacher and you don't really have that opportunity to take a significant period of time off until you have these breaks, well, then we have to find ways to restore ourselves in much smaller ways, micro recoveries. You can move to the next slide. So one really powerful way for us to do this, right, to have that immediate effect on our stress response system is to move. Just like the zebras run, when we are aware of feeling stressed, movement is probably one of the best things that we can do for ourselves. Not always possible, of course. When you are engaged in work, you're not able to just get up and move. I understand that. One of the interesting things about what we're seeing with COVID-19 is, as people are moving from working in the office to working at home, this movement has declined exponentially, not because people aren't exercising, but think about the number of times when you're at work, you just get up and walk down the hall, or you're walking from one meeting to the next, right? All these opportunities, all this movement allows us to go naturally into panoramic view. I mean, think about when you're going on a walk, right? What's happening when you're going on a walk? Unless you're doing this, which makes me so sad. When I see people out for a walk and they're just staring at their phone, they're actually not taking advantage of the recovery that comes from movement. Because when we are in motion, I mean, think about it, the world is going by us, right? It's slowly passing us by. And what happens is our eyes naturally go into panoramic vision, right? There's a brand of therapy, a style of therapy called EMDR, eye movement desensitization and reprocessing. And the individual who discovered this was out on a walk. And she noticed that as her eyes were scanning the environment and just relaxing, that the stress and the anxiety she was feeling was decreasing. And so she developed a style of therapy to actually use our eyes, our eye movement, to help us down-regulate our stress, right? So think about whatever you're doing, wherever you are, wherever you work during the day. Think about small ways that you can add movement or maximize your movement. If you work in healthcare and you're moving from patient A to patient B, that's an opportunity, right? And that's what we need to do, is we need to look for these opportunities that naturally occur in our work environment. You can move to the next slide, Tyler. So the other very powerful strategy that we have to help us immediately impact our stress response system is our breath, right? And so in this video that we're going to play, I just want you to have an idea of how our respiratory system works. What does it look like within our body? Go ahead, Tyler, you can play the video.
Mechanics of breathing. Consciously take a breath and think about the fact that there are 10 different muscle groups working together to make this happen. These muscle groups include the diaphragm and intercostal muscles. The main muscle used for breathing is the diaphragm. The diaphragm is a dome-shaped structure consisting of several large muscles, which is sandwiched between the chest cavity, containing the lungs and the rib cage, and the abdomen, containing the digestive system, including your stomach. The muscles that move the rib cage itself are the internal and external intercostal muscles. They are each attached to the ribs and run between them. To inhale air, the diaphragm contracts and moves down, while the external intercostal muscles contract, forcing the rib cage up and out. The combined effect of the diaphragm and intercostal muscles increases the volume of the chest cavity and expands the lungs. This expansion of the lungs increases their volume, reducing the pressure within them, causing air to be drawn in. This action is similar to a piston sucking petrol into a car engine. In normal breathing, we use around 25% of our lung capacity, which is called our tidal volume. As you inhale deeply, the diaphragm moves further down into the abdomen, pushing your belly out, giving more room for the lungs to expand and draw in more air. This type of breathing is called belly breathing or abdominal breathing and is critical to prepare you for your free dive. Belly breathing allows you to completely fill your lungs with air. The maximum amount of air your lungs can hold is called your total lung capacity. With training, you can use more of your lung capacity.
Okay, Tyler, you can move to the next slide. I don't know if that audio worked. It seemed like it was working in the beginning, but it sounded like it might have gotten a little wonky toward the end, but hopefully it worked for everybody. The reason I wanted to play that video primarily is to help us recognize the diaphragm. You can move to the next slide, Tyler. There are so many systems within our body that we cannot control, right? We don't really have direct control over our digestion, right? Our thoughts, the fact that our brain is continuing to formulate thoughts, we don't have a lot of control over those things. And sometimes when we try to help ourselves, we focus on trying to change or impact systems that we really don't actually have control over. But our breath and our diaphragm is one muscle in our body that we have direct control over, right? And the way we breathe. So I'd like for everybody just to pause for a moment and just really focus on how you're breathing right now. Just be aware of your breath. Wherever you are, whatever you're doing, hopefully you're not multitasking, because when we multitask, what we find is that we're actually holding our breath as we are shifting in between. And there's actually a phenomenon that is being studied right now that is sort of like sleep apnea, but that is occurring throughout our day. And it is associated with multitasking, because when we move from one task to another quickly, we tend to hold our breath. And that is impacting our overall well-being. So in this moment, just be aware of your breath. Are you breathing through your nose or are you breathing through your mouth, right? There's a reference in this PowerPoint of a book called Breath, written by James Nestor, who talks about the science of breath. And one of the things that he recognized or studied is the difference between mouth breathing and nose breathing. And he did an experiment where he blocked his nose for 2 weeks, he and a colleague, and then they measured the effect this had on their body for that 2-week time period. And what they found is that strictly mouth breathing had so many deleterious effects on their body, including blood pressure, heart rate variability, their stress level. They had a much harder time controlling their anxiety, controlling their stress when they were only breathing through their mouth. So think about when you're sleeping. Do you snore? Do you struggle with sleep apnea? A lot of these problems are associated with mouth breathing, right? So one of the first things that you can do in focusing on your breath is really learn how to breathe through your nose. And if you're somebody who has like chronic sinus problems and you find that you have this tendency to breathe through your mouth because you have these sinus problems, you actually can do something about that by practicing some of these breathing techniques that we're going to talk about. The other thing I want you to pay attention to is your inhale and your exhale. One of the things that we know when people are under stress, they tend to be inhaling very frequently, right? We actually are over breathing. We are inhaling too much. We're breathing too frequently, and that is impacting our level of stress. The other thing that we're noticing is that when we exhale, our exhales tend to be short and not extended all the way out. Remember that diagram. You know, when you exhale fully, that's when you are pushing your diaphragm down and fully expanding your lungs, right? So be aware of your inhale versus your exhale, okay? There's two other types of breathing that I want to just draw your attention to. Tumo breathing, or sort of is kind of like hyperventilating, right? That's what's happening for many of us when we are under stress. And Tumo breathing is characterized by frequent inhales with short exhales, and it's something like and when we breathe like that, even just that little bit that I did, I'm aware of feeling lightheaded, right? What happens when we're breathing that way is we are actually activating our sympathetic nervous system. Some of you may be familiar with a gentleman, his name is Wim Hof, H-O-F. He sort of has popularized this type of breathing, Tumo breathing, which has been around for centuries, practiced by yogis, Buddhist monks, as a way of strengthening our ability to bring on a stress response and then switch to a relaxation response. The key variable here is doing it intentionally, right? When we intentionally bring on that feeling, it once again gives us that feeling of control over our stress. Belly breathing is quite different, right? And so what I'd like for everybody to do is to put your hands on your abdomen, and you can even like take your hands and sort of put them at your lower rib cage as well. And I want you to take a deep breath in and try to push your hands out, whether they're on your belly or on your side. I want you just to intentionally push your belly out. So let's do that together. Let's take a deep inhale and exhale. And when you exhale, you want to feel your belly collapsing, okay? Let's do that one more time. Take a deep inhale and exhale. In that moment of belly breathing, what you are doing is you are intentionally controlling your diaphragm. You are making your diaphragm work and give your lungs the opportunity to contract and expand fully. And again, this is a strategy that just helps us gain awareness of the control we actually have over our body, over our breathing, and in doing so, over our stress response. When we control our breathing, we are controlling our stress response. We can move on to the next slide. So I want to give you just a few breathing techniques. There are so many out there to choose from. And this comes from, if you practice yoga, this is a type of yoga called pranayama, which is, you know, the focus on breathing and using our breath to control our physiological response of stress, right? So there's so many resources out there, and I have many on the end of this PowerPoint for you to explore. But one very interesting type of breath that has been more recently discovered in terms of its value is referred to as the physiological sigh. And this is actually something that we all do reflexively throughout the day. I remember as a young child, my mother would frequently sigh. She would walk into the room and she would just let out this sigh. And I always interpreted it as she was mad, like something was wrong. And then my coworkers said to me one day when I was in the office, "Carolyn, is everything okay? I noticed that you're sighing a lot." Was doing it without even being aware. And this happens to all of us because The physiological sigh is our body's natural way of controlling our stress response, of putting us back in balance. You can imagine, like, think about being on the end, like a high diving board or something, and you're getting ready to jump off that diving board. If you watch people do this, what's the first thing they do? They do that deep sigh in order to control the way their body is experiencing stress. The key component to a physiological sigh is the 2 quick inhales, and it sort of looks like this, followed by a long exhale. 2 quick inhales, long exhale. What's happening with that second inhale, right? We're in the first inhale, we are taking oxygen in. With the second inhale, what's happening is we are actually filling these sacs that are at the end of our lungs. They're attached to our lungs. They're called alveoli. And it's these little sacs, when they fill up with oxygen, that gives us the feeling of restoration. It's very interesting, years ago when they developed the iron lung, as a way of helping people breathe when they were, in the hospital and needed respiratory support. They did not factor in how frequently we engage in this physiological sigh. And they were noticing that people were going into respiratory distress because they had not factored in this physiological sigh. So even though we do it reflexively, what I want you to be thinking about is how you can do this intentionally, how you can connect just this very simple breath technique to something you're doing every day, right? Think about that little micro recovery, taking 2 or 3 quick sighs, 2 quick inhales in, followed by that long exhale. Let's move to the next technique. So I want to talk about something called coherent breathing. And this diagram and the following one, the one that we'll see next, comes from an organization called HeartMath, the HeartMath Institute. And one of the things they do with HeartMath is they pioneer these breathing techniques that are around coherence, right? Because when we are experiencing a high level of stress, we're seeing that our respiration, our heart rate variability, and our blood pressure rhythm are very jagged and irregular and not smooth and fluid, right? And that's what happens when we're under stress, right? We're not quite regulated. Our sympathetic nervous system is not in balance with our parasympathetic nervous system. So coherent breathing is a way to bring that balance, to bring on that balance, to get our sympathetic and our parasympathetic nervous system in sync. And as you can see from this diagram, when this coherent breathing, this technique is practiced, you can see the change in those rhythms and how, even though they're still somewhat irregular, they're more fluid and synchronized and coherent. It's bringing those two systems in balance. You can move to the next slide. The other key variable with regard to the HeartMath, they have a technique called the quick coherence technique. And one of the things that they emphasize in this technique is focusing on the heart, right? And you can even put your hand on your heart. And for a moment, I want you to think about something that really frustrates you, that really upsets you, right? That makes you so annoyed and irritated, like maybe a hassle that you deal with every day. And think in terms of that and just be aware of how that feels within your heart, right? And now I want you to switch your thoughts to something that you appreciate, a memory of an experience where you felt full and where perhaps a gratitude that you have, a moment that just maybe a social encounter, maybe, a moment with your child or with a coworker, something that really gave you a deep sense of appreciation, right? When we do that, when we switch and try to intentionally bring on this positive feeling within our heart, what they find is that our heart, which actually signals our brain even more than our brain signals our heart, right? Our heart is constantly sending messages to our brain, helping our brain know what type of neurotransmitters am I supposed to secrete, right? Am I supposed to secrete stress hormones, or something like oxytocin that makes us feel good, or dopamine? So our heart is constantly communicating with our brain. When we pause and we intentionally bring on that a positive feeling, we have a positive memory, a positive gratitude, it immediately engages our parasympathetic nervous system. And then when we pair it with something referred to as coherent breathing, we have a very powerful relaxation response. You can move to the next slide, Tyler. So for a moment, what I'd like to do is to get everyone to just you can focus on your heart. You can put your hand on your heart, or just put your hand on your legs. And let's for a moment just tune into the way we're breathing. Just be aware of how rapidly you're breathing. When you breathe, are your shoulders coming up, or are you able to sort of relax and focus on expanding your abdomen, doing that belly breathing? And let's just try our best to slow our breathing down. And the key component of coherent breathing is that our exhale and our inhale match. So if you're able to do this to 5 counts, that's great. But if that's a little bit challenging, you can do it to 4 counts or 6 counts, whatever feels most comfortable to you. But right now we're going to do a 5-second count. We're going to breathe in and out. Breathe in and out. Breathe in and out. Breathe in and out. One more time. Breathe in. Breathe out. Breathing at this pace for about 5 cycles brings us to about 5 breaths per minute, which is associated with relaxation. When our parasympathetic nervous system is engaged, we are breathing slowly. And so using this type of coherent breathing, let's just imagine 1 minute at a time. 5 cycles does not take more than a minute. But let's imagine you weave this in between activities. Okay, let's say you're on a stressful meeting and the meeting has concluded. And now you have the opportunity to pause for 1 minute and you just do this coherent breathing, 5 in, 5 out. And even better, adding that feeling of gratitude or appreciation, that memory of an event that went well. You do those 2 things together, and in that moment, you have that little hit of dopamine, just that little bit that down-regulates our sympathetic nervous system and allows us to move forward with more energy. It allows us to keep going, okay? Let's try one more breathing technique. You can move to the next slide, Tyler. So this is a video that we're going to watch with a breathing technique called 4-7-8 breath. It was, I don't know if Andrew Weil developed it, but he certainly is a strong advocate of it. He teaches all his patients how to do this type of breathing. And again, this is a way to just restore our energy. It's a technique that's used prior to sleep to help to bring on sleep. So let's go ahead and take a look at how this is done. Go ahead, Tyler.
The famous 4-7-8 breath, the relaxing breath that I teach to all patients and doctors and students and friends, another yoga breathing technique. In this, you try to keep your tongue in the yogic position, touching the tip of the tongue to the ridge of tissue just behind your upper front teeth, like that, and try to keep it there the whole time. You breathe in quietly through your nose to a count of 4, and you hold your breath for a count of 7, and then blow air out forcefully through your mouth. Helps if you purse your lips out and you make a whoosh sound when you do that. So the exercise begins by letting all the air out through your mouth. Then you close your mouth, breathe in silently to a count of 4, hold your breath for a count of 7, out through your mouth audibly to a count of 8, and you will repeat this for 4 breath cycles. Looks like this. That's it. You must do this at least twice a day. You can do it more frequently if you want, but never more than 4 breath cycles at one time, at least for the first month. After a month, if you're comfortable with it, you can increase to 8 breath cycles, and that's the absolute maximum. It's desirable to slow the whole exercise down as you practice it. What limits you is how long you can comfortably hold your breath, but as you practice that, you'll get better and better at it. And after doing this for 4-6 weeks, you can begin trying to use it for things. If somebody says something that pushes your button, you do this exercise before you react. It's a great way to deal with cravings. It's a great way to help you fall asleep. If you get up in the middle of the night for any reason, get back in bed, you do the exercise, you'll fall asleep easily. After 2 months, 3 months of regular practice, there are very significant changes that happen in physiology. This lowers heart rate, it lowers blood pressure, improves digestion. It is a very powerful anti-anxiety measure, in fact, much more powerful than the anti-anxiety drugs that are commonly prescribed. Takes no time, needs no equipment, very time and cost effective. Everything to recommend it, so I urge you to begin practicing this.
Thanks, Tyler. I think that one worked well. I'm glad. You can move to the next slide, Tyler. So hopefully, you tried it out, but of course, if you didn't, you will have access to this PowerPoint, and you certainly can try that breathing technique, ideally right before you go to sleep, to see if it helps to bring on sleep for you. One other breathing strategy I want to just alert you to is alternate nostril breathing. So what I'd like everybody to do right now is, and I'll lean in a little bit so that you can see. What you want to do is to put your finger kind of in that little divot in your nose and block your right nostril and just breathe in through your left nostril and exhale. Now try the other nostril. Block your left nostril and breathe in through your right and exhale. what you are likely to notice is that one nostril is more blocked than the other. This is incredibly normal, and this is something that happens throughout the course of the day. About every 90 to 120 minutes, that will alternate, where one nostril will be more blocked than the other, right? And so alternate nostril breathing is a way, once again, to balance our nervous system, just like coherent breathing. In that moment, if you're experiencing a really stressful moment, one very quick strategy that you can use is blocking your right nostril and just breathing through your left. And doing that for about 5 breaths, because your left nostril is connected to your parasympathetic nervous system. If you're actually trying to energize yourself, if you're getting ready to take on a challenging task and you want to increase your energy, right nostril breathing will do that for you, because your right nostril actually speeds up your energy. It revs you up. It's more connected to your sympathetic nervous system. So alternate nostril breathing involves, and now this is not easy for folks to do. It took me a while. But if you're able to put, your 2 fingers down and have your hand in this position, if that's too hard, using this type of position and blocking with your thumb, your right nostril, and with your pinky or with your, your second finger, index finger, where you're just sort of alternating between these two, whatever's most comfortable for you. Alternate nostril breathing includes inhaling, so blocking the right and inhaling, exhaling, and then switching and blocking your left nostril. Exhale. Switch again. Exhale. And alternate. This is another great strategy to have that immediate effect on your stress response. And again, doing about 5 cycles of alternating is a great way to just, again, weave in that little micro recovery. You can move to the next slide. So I'm aware of our time, and I want to spend the rest of our time together just quickly helping you think about how you can make some of these strategies part of your daily life, right? I love this statement. You do not rise to the level of your goals, but rather you fall to the level of your systems. This is an important concept for all of us to be thinking about. There is a reason that most of us fail at New Year's resolutions. There's research out there that shows by now, this time of February, most people have already abandoned their New Year's resolutions, right? Because unfortunately, what we focus on is setting goals, right? And goals are great, and like a goal of losing 10 pounds, that's a great goal, right? Okay, it gives you a direction. It's something that you're focused on. But the goal itself does not help us identify the path. And remember, the path is what is so critical, right? Because if we're not on the right path, we're not getting that consistent sense of reward, along the way. And so we quickly abandon our goals. And so let's say you have a goal of integrating these breathing strategies into your daily life, right? Because you want to, have that feeling of just restoring yourself throughout the day. Well, what we need to look at is your system. You can move to the next slide. Because unfortunately for all of us, we are what we repeat. Think back over the course of your day. What do you do every day, right? And the more you repeat that, the more likely you are to continue to do it. Right? We are what we repeat. So every time I feel distressed and I turn to food as a way of alleviating that stress, the more I repeat it, the more it becomes, you can move to the next slide, the more it becomes a habit, right? We are made up of hundreds of habits, many of which are automatic, and that is the goal, right? The goal is to create many, many habits that are automatic, that we don't have to think about, so that our brain is not constantly focused on these behaviors. We're always trying to move these behaviors to the background, right? So a habit is a routine or a practice performed regularly and becomes an automatic response to a specific situation. And that's what we're looking for, is to create a system that allows us to sort of automatically implement some of these strategies. You can move to the next slide. So let's talk for a moment about how do we create habits. Okay, let's go to the next slide. So the first step in creating a habit is doing something that is referred to as the pointing and calling system. In the Japanese railroad, they use this to identify and articulate and raise awareness of all the steps, the safety steps that must occur prior to a train leaving the station. And so they use this, they verbally say it and they point at the same time. You'll see this, you know, with lifeguards. If you've ever noticed the way they go around the pool, they're pointing and they're verbalizing safety, you know, about what's happening within the pool. And all of this is to raise our behaviors to our conscious awareness. So that is the first step in us developing new habits, is we need to know what we're already doing every day. You can move to the next slide. And so one of the first things that we need to think about is, when developing a new habit, is we need to make it obvious. These are the triggers that we have within our environment. If you're trying to develop an exercise habit, you want to make your exercise gear very obvious. You want to put it somewhere where you see it all the time, right? If you're trying to develop a breathing habit, you want to put some type of external cues around you that make that very obvious, right? So one way that we can do that is something called habit stacking. So think about what you already do every day. If you're a healthcare worker, think about the number of times you wash your hands or sanitize your hands. For all of us, right? It's something that we're doing so frequently right now. Well, habit stacking would be, every time I wash my hands, I'm also going to maybe do some coherent breathing, a minute of coherent breathing while I'm washing my hands. And I can use that motion of washing my hands as a trigger, as a reminder that I'm also going to slow my breathing down at the same time. That's an example of habit stacking. You can move to the next slide. We also want to make it attractive, right? We want to make it appealing. So if you work as part of a team, making it something that you do collectively as a team. Maybe this is how you start your meetings, right? Rather than just launching into your agenda, make it attractive and create some type of ritual that is around wellness before you launch into that activity. Next slide. I'm moving quickly because I'm really aware of our time. I know it's 1 o'clock. The other thing that we need to think about is making it easy. Often our New Year's resolutions fail, or we fail at our goals because we make them too hard. And we think we have to do that in order for it to be meaningful. But in actuality, if we're trying to develop a new habit, we want to make it as easy as possible. 2 minutes or less. That's why I'm talking about only breathing for 1 minute at a time. Make it easy. Don't place so much pressure on yourself that you make it hard. Automating your habits, using an app, a meditation app or a breathing app that reminds you to pause and reflect. That's using our technology to automate the habit so that we don't have to think about it. You can move on to the next slide. And of course, making it satisfying. One of the things I talk about with leaders is we celebrate when we accomplish goals, like when we reach our quotas, when we meet certain metrics within our job. But are we holding people up who have integrated wellness habits? Are we reinforcing them? Are we celebrating them, you know, for taking good care of themselves throughout the day, or being creative about how they take care of themselves? We need to be rethinking about what we are rewarding at work. Move on to the next slide. Two quick exercises. If you find yourself really stressed out and you want to just slow down, start by just tuning into your senses. Use this technique to sort of bring you to the moment and then integrate a breathing strategy. So focusing on your senses, because your senses always exist in the present moment, right? So focusing on your eyes, your touch, your hearing, your smell, and your taste will help you quickly bring you into the moment. You can move on to the next slide. And one more simple strategy is using objects, external objects that are familiar, as a way of reminding ourselves to slow down. I love this stop sign, you know, because it triggers us to stop, take a breath, observe the stress that is going on in our body, right? That's what we have to do. And then proceed with self-compassion, which means we engage in an activity that is about our self-care. Move on to the next slide. I think that's it. Okay, so I want to quickly pause. If you need to jump off, please do so, but I want to just open up for questions or comments, anything that anybody would like to share. I don't know, Tyler, are folks able to unmute themselves, or do they just need to put it in the chat?
They can now unmute themselves as well.
Okay. Does anybody have any questions or anything they would like to add? Any experiences that they have of doing something like this, these techniques? An hour never seems like long enough. I'm sorry for having to race through the last part.
Hi, I'm interested in learning about the posture that one should have while we're doing the breathing.
Yeah, you know, what I would say is the most important thing to think about is being comfortable. But really, these are things that you can do while standing up, sitting down, laying down. Because what you're really focused on is just lungs. And you can imagine that you can do this really in a lot of different postures. But whenever possible, trying to be comfortable. So it's not so critical that you're sitting down, laying down, or standing up. It's more about just be comfortable, because getting into that comfortable position, again, automatically relaxes you. Any other? One of the things that's really interesting, you know, with COVID is they are finding that, you know, of course, they're treating it differently than they did in the beginning. And in the beginning, folks were laying on their back, and they realized that that was obstructing their breathing. It wasn't allowing them to breathe completely. So if you are laying down, you might find lying on your side to be better. That allows you to expand your abdomen, and that's actually recommended as a better sleeping posture than laying on your back or on your stomach. Any other questions? Well, I know that we're out of time, and I'm sure many of you have to jump off, but please feel free. If you do have questions, you can certainly send those questions through to preferredeap.org. If you go to our website, we have a contact us page. Please ask questions if you want additional resources. If there's something that we can do to support you, please let us know. There are, in this PowerPoint, which you will have access to, there are many resources and references to explore. You know, take a look at some of those to expand your knowledge of these breathing strategies. This was just a quick, brief taste of what we can do, but certainly there are many, many different types of breathing techniques out there that you can try. So, anybody else before we close?
Well, I'm sorry, I have a question about head alignment. Is that something that we need to keep in mind, where, for example, the inion and the back of the spine that meets the inion down to our down the back of our spine.
Yeah.
Sometimes I get a lot of pressure there, so I'm wondering, with the breathing, what would you recommend?
So what I would definitely recommend, again, is being comfortable. So if you have a pain anywhere in your body, is trying to provide support without it relying totally on you to support. Like, so if you're having trouble with your neck, maybe lying down would be best, or leaning back so that you're resting your head. When you talk about alignment, that really is important when it comes to going into panoramic view. Right? So when we go into panoramic view and we are gazing off in a long distance, one of the things that's important for us to do is to keep our heads still, right? And just keep our eyes still and just gazing out. That is important to sort of slowing us down. People who are anxious, you'll see, are kind of like their head is all over the place. So making your head still, your gaze relaxed, looking forward, just kind of looking off in the distance is important. But in terms of comfort, if you are having pain, go ahead and try to alleviate that pain. Make it easy, right? You want to make it easy on yourself to do these strategies as much as possible. Anybody else?
Thank you.
You're welcome. Okay, well, thank you everybody for being here. I see folks are dropping off. So this concludes our webinar, and I hope you all have a wonderful day. And please do feel free to reach out to Preferred EAP if you have any questions or would like additional information about what we spoke about today. Thank you so much and have a great day.